Good morning. Can you hear me? Just checking. Good. Thank you, Justin. So we'll just pause for a few moments before we get started. It's a very busy Friday, so I'll try to actually end on time today. Good morning, everyone. Let's go ahead and get started. Good morning. My name's Larry Klein. I'm mayor for the city of Sunnyvale. Welcome to May. So welcome to Happy May Day, and welcome to the seventh, wow, virtual office hours that I've been having. People say that they really appreciate what, having this weekly basis, this address. It's a good chance for them to touch base and figure out what's happened over the last week. So I'll continue to do these until the end of the shelter in place. This is a great time for me to answer people's questions, as well as summarize everything that's happened over the last week. These are extraordinary and difficult times for everyone, both mentally and physically. And I think it's really good for people to hear what's going on, what's happening in our city, in our county, in our state, as well as, figuring out how this is moving forward, where we stand as far as, the number of COVID cases in the county. So I'll continue to do this for a while, as long as everybody finds it useful. I hope everyone's staying healthy. This Facebook Live event allows me to kind of reach out. Before this all started, I had my weekly office hours. And now, it's like, okay, with the shelter in place and the social distancing, I really miss meeting one-on-one with people. And I've been having, lots of Zoom meetings and phone, but it's not the same. And at least this is a way to kind of get the word out on what's happening in our community. Sheltering in place has helped, so please keep it up. the county health orders are still in place, and they're changing a little bit next week, and we'll get into that later. But continue to wash your hands. Wear your face covering while you're out. Don't touch your face. Maintain that social distancing while you're out, going out for essential items or around the block. But the best news that I've heard is, the Bay Area and California overall is flattening. The number of the rate of new cases does seem to be flattening. It's not really downturning yet, but it has definitely flattened. We're not out of the woods yet. You could be a carrier of the virus and still be asymptomatic. So, and that number that I've seen from numbers is 25 to 80%. So, depending upon which study you're looking at, it is very important that if you're out, to wear your face mask, making sure at all times that you're coming in contact with people. So when you're at the restaurants, when you're picking your takeout, or when you're at the grocery, it's really important that you're wearing those face masks and trying to maintain that 6-foot distancing. Okay. So, I want to start off by the way I have several times, is just thanking all the essential workers that are out there, all the healthcare workers, all the, public safety, all the restaurant workers, and, everybody that's on the front lines of this. It is very difficult. It's very difficult on them and their families. A lot of them haven't seen their families. I was talking to one of the fire department people last week, and she hasn't seen her children other than through the windows for the last month, mainly, to maintain that social distancing. They're staying with the grandparents and the husband, but making sure that they're not getting exposed. So it is very difficult, and I just want to thank them for everything that they're doing. So let's go ahead and get to kind of an update of the last week. It's been, another busy week. It's 45 days since the March 16th county health order of shelter in place. So since that declaration, a lot has happened, and a lot happens every day. There's federal calls, state calls, county calls. I'm talking to the city manager and city staff on different issues. So there's a lot going on, and I understand, there's a lot in the news, and it's hard to keep track of everything, but I'll try to summarize really what's affected us in the last week. On Tuesday, California Newsom, and so Governor Newsom, California Governor Newsom does his daily noon meetings, so noon video press conferences, and those have been really good as far as tracking what's happening in a state level. So on Tuesday, Governor Newsom did two things. First, he unveiled plans to move the state out of the current shelter-in-place order and kind of returning to normal. And 2 weeks ago, he put out kind of the 6 indicators, and I'll kind of go through what those indicators were. The 6 indicators as far as modifying that stay-at-home order were monitoring and protecting our communities through testing, contact tracing, isolating, and supporting those that have tested positive. So that's really important. Prevent the infection in the people that are at risk, handle surges, develop therapeutics to meet demand, ensure businesses, schools, and child care facilities can support physical distancing. And number 6, determine when to reinstate certain measures, such as the stay-at-home orders. So, Governor Newsom basically laid out the 4 stages of how we will come out of this. And, that was important. So looking at those 6 factors, then going forward and saying, okay, here it is of how we will come out of the shelter in place. So first of all, stage 1, safety and preparedness. So the state will build up several things: testing, tracing, PPE availability, and hospital capacity. And all those things are being tracked at a county level, and we're feeding that information to the state level. So we prioritize, our essential workers and support for them. We also set, safety guidelines for that expanded workforce to make sure that if restaurants are opening, here's what they need to do. And Governor Newsom, as far as that safety, from a county level, kind of closed the beaches in Orange County, and or later in the week. And so this is, really critical that as we're monitoring this, making sure that we're prepared to deal with this from a county and from a state level first, and then looking at, how we can open things up. Stage 2 is lower risk workplaces. So opening up some lower risk workplaces. So that's curbside pick for retail, non restaurants, reopening manufacturing, office workers that can return to work, if possible, for those that can't telework, and then of course access to public spaces. So we're increasing access to public spaces from a county level next week. That being said, it's like, as Governor Newsom did this past week, closing down the beaches if people aren't practicing safe social distancing. Stage 3 is higher risk workplaces. So these are, restrictions on gathering sizes and other limits to open up high risk workplaces. These are salons, gyms, sports, and movie theaters, and then religious services, and can return to in-person settings, but then maintaining some sort of restrictions at those services. And lastly is ending the stay-at-home order, which we're all, looking forward to at the end of the day. And that's the highest risk environments, opening those up, live sporting events with fans, concerts and festivals, conventions. So that's kind of getting back to normal. But, even with that, it's making sure that, we have the appropriate measures. And because of looking at the 6, indicators, conceivably figure out at some point that we might have to reinstate the stay-at-home order at a later date. If we start seeing a large uptick in COVID-19 cases, then figuring out, do we need to again ratchet down the amount of people gathering, all of that. So Governor Newsom laid out, and I think in a very good way over the last 2 weeks, here's the indicators that need to be tracked, and then, here are the stages as far as opening up. And we're tracking this, and every county will be a little different. And our county has made some changes for next week. Some counties are completely or are opening up in a much wider basis because they have far fewer cases, and the incidence rate has been very low. And so we'll see how this rolls out in the next few weeks. The other thing that Governor Newsom did on Tuesday was start talking about possibly opening up the schools in July. And so this was, to me, a thought balloon to our public school systems, because of kind of the loss of schooling that's happened kind of at the end of this year as we transition to distance learning. It's also figuring out that there might be issues in the fall as far as, a resurgence of COVID-19, not really having that crystal ball, trying to pull in opening up schools earlier. Now, that, of course, is a big issue for resources and staffing and everything else. But of course, we'll figure out how that rolls out. Governor Newsom is talking to a lot of state leaders, a lot of the people in the education industry, and trying to figure out what's best, what makes sense, and what kind of can actually happen logistically. It's like a lot of teachers are used to being, not working in the summer and either have other jobs or have other plans. And so how it rolls out becomes a big question. So that was a first kind of stake in the ground, that pulling in the school year from late August to July. We'll see how that happens at a state level and what happens also at a local level. Okay, let's see what, and then from a Tuesday standpoint from City Council, we didn't have anything COVID related. So, it's either in this, for the last few meetings, we've had something related to either funding or, the eviction moratorium, the utilities, basically making sure that the utility rates aren't increasing for water and garbage collection, but also extending the suspension of not turning off people's water if they're not paying their bills. So all that kind of is rolling out. But this past meeting, Tuesday night, we did remote, and people sent in some comments. We're able to take both written comments for up to 3 minutes or voicemail that will be played during the meeting. So that is functional. But from the two main items that were on our agenda for Tuesday, one, we adopted a resolution to confirm the annual report and levy of collection for the downtown Sunnyvale Business Improvement District. And so this is basically fees that are a levy on all the downtown businesses that help support all the downtown activities. It kind of feeds back into that whole area. One thing we did do was kind of extend. Normally we collect those monies at the beginning of July. We pushed the collection of those funds now to the end of October. And so the business district can figure out whether or not, depending upon what the state of the economy is and what those businesses are, whether or not to actually, completely defer that for the year, depending upon what the businesses, the state of those businesses are and the state of the economy is, or conceivably collect that or collect a portion of that in October. But we did kind of approve the collection of that business improvement district fund fees, and so that's really important. The other thing that we did was we approved the proposed conceptual park design for a new city park at 1 AMD Place. So this is the old AMD campus. AMD moved its headquarters out of the city several years ago. Irvine had basically purchased that land, and what they're doing is going through a process of building a certain amount of apartments and condos. It's around 1,100 units altogether. But part of the deal with the city was the creation of a 6.5 acre park. So that outreach has been going on for probably 6 months or so, getting a design, before the shelter in place. So probably even more than that, about 8 months, as far as collecting information from neighbors. So that's right near the San Miguel, which doesn't really have any parks. So critical that creating the 6.5 acre park right there at Duane and Lawrence is approximately where it is for those people who don't know where the AMD campus was. Creating a 6.5 acre park was really important for the families in that neighborhood who didn't have a large park to go to. So that outreach happened over a period of time, and finally at the end of that, went to the Parks and Rec Commission, and they gave it a big thumbs up. And then it came to council. We raised a few questions about some of the final design, but overall, it's a really great design. They kept all the redwoods or the majority of the redwoods that are at 6.5 acre park. And then, for that overall site design, which was approved about a year and a half ago, the trees all the way around, along Duane and that area remain. So all the main trees and building, the new apartments and the new condos, and kind of redoing that street grid so that everyone doesn't have to turn on Duane, so people can go straight into that community, as well as some of the other condos on the other side. That's an old industrial to residential area that was approved back in the 80s, 90s as ultimately moving into residential. That now has mainly moved into residential. So you're seeing more and more of that in that general area. But adding that 6.5 acre park really adds to our overall park numbers. The way things are right now, the park wouldn't be built, I think, until 2022. I think that's the opening of 2022. So they're in the process of building the residential construction right now, because a certain portion of that was affordable. With old county order, that, as I mentioned before, if you had more than 10% affordable housing, then you could actually do construction. Well, the below market rate for sale condos, 12.5% as per city code, city ordinance, has to be affordable. So that was moving forward accordingly with that. So that construction has ongoing, along with several other residential construction in the area, as that was as allowed by the current county order. And then on Wednesday, so Wednesday is a big day, the county health department announced that they would be extending the shelter-in-place order. And so that's been kind of an ongoing effort. And it was announced earlier, in the week, Monday or Tuesday, that yes, all the counties in the Bay Area would be extending it. It was due to end on May 3rd. And what came out on Wednesday was basically redoing a lot of the county order, but also the important thing was loosening up certain things. But we'll go into all the details and tightening in a few things. And I appreciate some of the things that the county has done. So on Wednesday, the 6 Bay Area counties, I think it's 7 now, released their new shelter-in-place order. The order extended the shelter-in-place to May 31st, and we'll see if it needs to be extended another time. But that's kind of the next stake in the ground. So end of April now, or beginning of May, was now moved to the end of May. And the order also loosened certain restrictions. The new activities that are allowed are all construction. So as opposed to affordable residential was the only above 10% affordable, 10% of the project is affordable. Now it's all residential and all commercial projects, as long as they follow new project safety protocols. So there's still masks and social distancing of a certain amount that are being required during construction. Same that was being applied to the current residential construction that was underway, but it was important that was well defined. All real estate transactions are now allowed. So as opposed to appointment only house showings, now that we will actually start seeing some open houses. Child care establishments, summer camps, and educational recreational programs that provide care for children of essential personnel, and that's the critical thing here, who are allowed to work outside their homes, now can go on. So if you have a child care facility, summer camps, and all those children are for essential workers, they can go on. Now, of course, there are lots of restrictions about how big, how many children can be part of that, and making sure that those groups aren't intermingling, so that the same group of 12 up to 12 children are meeting together if they're in, and none of them are sick, but basically to try to reduce some of the cross exposure of children and families that aren't being exposed to one another. So there are a lot of protocols around that. And then outdoor businesses can resume. So that's nurseries, landscaping, and agriculture. And so I've had a lot of people asking about that for a while. We can get into details, but people have been saying, why do Lowe's and Home Depot, or how are they allowed to operate when Summerwind and Yamagami's can't open? Finally, that will change all on Monday. So until Monday, all the existing order is still in place, and then at midnight Monday morning, or Sunday night, then this new order takes it is in effect. So let me go through a few things as far as the new order. So that kind of gives a quick summary of all the new types of businesses that are allowed to operate. And so there's been somewhat of an opening up. Construction can happen. People can have their gardeners, and I've had a lot of people, email me about why can't gardeners, be active in our communities. And I have been talking to the county and trying to make the case for nurseries, for gardeners, mandating masks, testing. We'll get into testing a little bit later, but all these sorts of things have been very active. I've been very active, and so at least the county is listening. We've had lots of discussions, and so seeing landscaping opening, seeing some of the nurseries open, does respond to some of the questions that people have asked. And they've been doing other lobbying. I've suggested also lobbying with your county supervisors, directly with Dr. Cody. This is, and it's kind of an interesting relationship between the county supervisors and the director of county health. It's like ultimately she's in charge of the health of the county and doesn't directly report to the county supervisor. So they could be in complete agreement on some measure. And that being said, ultimately she has the final say on the health of the county. And there's an issue about resources and kind of that push, give and take as far as the resources that are required. But in general, that's actually, the director of county health has the final say on health matters. One of the things that the new county order finally does is it mandates masks, and that was kind of an odd thing that our county hadn't done it. For when you're in a place of business that's not your home, and it's kind of buried in the language of the new county order. Previously, all the other counties have been fairly clear that if you're in a place of business, so a grocery, a restaurant that is not your home, so once you're outside of your home, or if you're out in public and can't do safe social distancing, you're mandated to wear a mask. Up until Wednesday, from our county standpoint, that was strongly urged. And so it was changed a few weeks ago when multiple counties specified it as, we now mandate the wearing of face coverings. Our county went to strongly urge and kind of got lost in the shuffle. But that non-mandating of the face masks, I thought was the right thing. And in the meantime, there are multiple businesses. I know Costco just did it this week. Zanotto's has been handing out, and I helped them get some masks last week. Zanotto's has been handing out masks to customers coming in. They don't want their employees getting sick as much as their employees are wearing masks. It's also important that the public that are coming in have some sort of face covering so that they're not exposing services, their employees, to conceivably asymptomatic symptoms of COVID-19. So one of the things that the new measure was define social distancing protocol that every restaurant, every business needs to update their social distancing protocol. And one of the things, and it basically specified several things that protocol needs to do. So there should be a protocol posted at every business that's currently open, or that's open on Monday, and so it needs updated accordingly. Limiting the number of people who are allowed to enter, require, and this is the important thing, requiring face coverings to be worn by all persons entering the facility other than those exempted from face covering requirements, and that would be conceivably young children. So now, this new policy that every business needs to post requires face coverings to be worn by all persons entering. Need to mark 6-foot increments at a minimum. They need to provide hand sanitizer or soap, water, effective disinfectant. They also need to regularly disinfect high-touch surfaces. They need to provide for contactless payment if possible. And if not, then they need to disinfect payment portals, pens, styluses for use. And then they need to post this sign of what that new order is on the entrance at the end. So and people that are exhibiting, and one of the things is a warning, people exhibiting COVID-19 symptoms should not enter. So it's trying to remind people as well as put in place the appropriate measures so that people aren't wearing, who aren't wearing masks, who aren't wearing face coverings, aren't allowed to go into restaurants. I was still surprised in going into Target and going to Safeway that there are still a good number of people who aren't wearing masks. And, it's 70 or 80% are wearing face coverings of some sort, but there's still 20 to 30% that aren't listening. So I'm glad that the county has finally put that in place starting on Monday. So at least that's a big step forward. I've been asking for it for several weeks now, and I think just from a consistency standpoint across the Bay Area, it's a lot easier if that's the case. That the more consistency we have of on this side of the county line it's one thing, and on that side of the county line it's another. It causes confusion, and so the more of a blanket order that we can have across all of our counties, the better it is for everyone. And so the other thing that the county put out was the indicators for assessing progress containing COVID-19. So this is similar to some of the governor's indicators. It's the total number of cases that in the community is flat or decreasing, and that's and we're monitoring that. There's a good dashboard that of available information that the county's putting forward, and so that's available every day for those who actually want to read it. It's updated daily, and we'll talk about what our numbers are a little bit later. And then let's see, indicator number 2. We have sufficient hospital capacity to meet the needs of our residents. So we need at least a week of no more than 50% patients with in non-surgical hospital beds are COVID-19 positive. So making sure that we have appropriate hospital beds, and that's one of the factors that's being tracked from a county level. Sufficient COVID-19 viral detection kits are being conducted each day. So making sure that we actually have enough kits to do testing, and ultimately getting to the point where we could, do 10K, 20K, 50K, 100,000 residents per day if need be. Indicator number 4, we have sufficient case investigation, contact tracing, and isolation and quarantine capacity. So, the first thing, of course, is if we find somebody that has COVID-19, if we start doing more testing and find somebody with COVID-19, we then need to track back and do investigations of how many people have they come in contact with, how long have they been sheltering in place, all those important things, and then have additional tests for the people that they've come in contact to. So it's a rippling sort of effect, and so having the appropriate capacity for testing is very critical. And that ultimately breaks kind of that chain of transmission. And then indicator number 5, we have at least 30-day supply of PPE, personal protective equipment, available to all of our healthcare providers. And so that was one of the reasons why the county did a full inventory and asked all businesses to actually do an inventory last year or last month, earlier this month. It's all merging together, but it's making sure, and they've been doing ordering. That's been happening at a state level and being redistributed to different counties. So it's making sure that we have appropriate PPE equipment for at least 30 days. So making sure that we have an appropriate stock and we are prepared for a next outbreak. So that's a quick summary of what's happened, at the county level, at the city level, at the state level. Things are happening on a daily basis, and I'm sure there'll be another press conference, later today, tomorrow, Sunday, either at the county or at the state level, that really will change something, do some tweaks to this. It's an ever-changing world right now, and I know it's a really difficult for people to stay up to date. Don't be a news junkie unless you can really bear seeing the same news or conflicting news at times coming into you. So I did want to touch base on the county dashboard. So the county updates their dashboard on a daily basis. Over the last week, the number of cases increased slightly. We're seeing a leveling off. So the San Jose, from the numbers from yesterday or from last night, San Jose now has 1,436 cases of COVID-19. Sunnyvale has 120. Santa Clara has 102, and then the rest of the cities and county, there's a breakdown from city. There's still a few cities that still have less than 10. Los Altos Hills, I think, is the main one. Monte Sereno is the other one. So everyone else has the teens or up to 100, or say, which has a large percentage of the population in the county, has the largest number of cases. And then from, let's see, and then of course, let's see, the number of cases basically has increased, and there's also were 4 new deaths that were announced yesterday. So we aren't out of the woods at all. Continue doing what you're doing, continue to that safe social distancing. But right now, we're seeing good numbers. Definitely you look at, Santa Clara County was one of the first to put shelter-in-place orders in place. And at that point, we had the most cases. And looking back, we had, we're still counting of cases that set that as first cases in the U.S. But you're looking at the numbers in Los Angeles County right now, dramatically growing, and it's really important that we set a good example, and the measures that we put in place are really working. So, and as far as myself, I've been doing a lot of advocating, and so that's been from the masks to testing to funding, trying to get appropriate funding for our service organizations, Sunnyvale Community Services, to gardening and gardeners and nurseries, all those issues, taking them back to the county, making sure that here's what our residents are saying. How can we, change the measures to make it, easier for our residents and better for our businesses in the long run. One of the things that you'll read in today's San Jose Mercury News, I've been working with Liz Niss in Palo Alto, who, used to be Palo Alto mayor and has been active, in the state capital as well as locally for many years, but has a history in healthcare. And, we've been trying to get appropriate testing in place. We talked a few weeks ago that we have to start testing in Sunnyvale, and the county decided not to do it. One of my positions right now is president of the Cities Association of Santa Clara County. And, I'll say is probably the first time in maybe a long time, all mayors, so all 15 mayors in the county, as well as Liz, who kind of drove this effort, wrote a letter to the county health officials, county health department, the county supervisors, asking them for accelerated action to ramp up testing. Because, at the end of the day, and you've heard this more and more, what's critical first is testing. Testing is critical for us to know who's been infected and when people are symptomatic or those that are not asymptomatic, getting tests to figure out, whether or not they have the antibodies. All this is critical, ramping those numbers up. So a letter went out, and I was really happy that we were able to get, all 15 mayors to sign. That was that. And in talking to several of the county supervisors, that was much appreciated. It showed the unity of the different cities in our county. And what we basically ask in the letter were several things. Identify a clear goal or threshold in quantitative terms for testing frequency sufficiently to reopen schools, businesses in our county. So making sure that, what's the threshold where we have enough tests and enough people test in a quantitative way that we can start opening up and getting back to normal. So making that fairly transparent to all the cities in the county. A comprehensive list of testing sites. So right now, certain hospitals are doing it, and it isn't well defined. And so, or certain, medical facilities are doing it. The county is doing it at certain locations. And so it's making sure that, that's available to everybody. That's very clear. Here's where you can go to get a site, to get a test. Looking at Alameda County, they have several drive-through sites that anybody who wants to get tested can actually go there and get tested. And people actually come from other parts of the state because they want to get tested. Identify the needs with regard to identification of testing sites so that cities might help. So if there's specific needs the county has in order to setting up testing sites, the cities will be happy to have them. It's like we've heard from enough residents that, they want their businesses to open, but they also want to be tested. And so trying to figure out the right locations, North County, South County, West Valley, East County, it's making sure that the whole county is being covered and an appropriate number of tests are being provided. And then of course, identify the number of people, the number of people needed to make sure that it's sufficient to run these test sites, and whether or not that's city staff helping out, whether or not that's unemployed people that can now be put back to work in this specific, effort, as long as they're trained. All those sorts of things are important. So we'll see, right now the county, in looking at the Mercury News article, the Dr. Smith wasn't, or Mr. Smith wasn't from the county, wasn't particularly, responsive. That being said, it kind of put a little more pressure on how do we get there? How do we, right now the county is aiming to increase testing to 3,000 to 4,000 a day. And, it's important that we get a much higher number, but it's that discussion, having that dialogue is critical, and having a unanimous, I'll say, voice from the mayor saying that there's a need and what can we do to help is one of that is an important step as far as getting testing for everyone in our county. So, and then we'll go to a little good news. Yesterday, you might have read Gilead's remdesivir. So Gilead, Sunnyvale company, which, there's a big announcement about 5 weeks ago now, about Gilead's testing. So their drug remdesivir improves recovery time for coronavirus patients in a New Hampshire trial. So that's an important first step. Now it didn't, it's not a silver bullet as much as we would have hoped it to be. but it did accelerate the recovery time. So by more than 30%, 40%. So that's an important, step. It's, it's, we need a full treatment. We need, a solution, ultimate solution, but we're getting closer. And that's, I'm very happy that Gilead, a Sunnyvale company, is leading the way. And so the FDA is going through fast tracking that approval, doing tests. We'll hear more about, how the tests go by the end of May. Okay. New questions. So I had several questions this week. What's happening with AMC and Whole Foods? And I seem to get that, every week or two. As far as AMC is concerned, it's a big question mark. But we'll get into that. I reached out to City Line, and they're overjoyed about the county order that now will allow commercial construction starting Monday. So Whole Foods will be starting on Monday. So they still have, so they're a little bit farther behind, from where I thought they were. It's ramping back up. It's making sure their supply chains are in order now. So they're guessing it's about 4 months, maybe a little bit more, before Whole Foods is complete. And they're working as fast as possible to open that, hopefully late summer, beginning of the fall, September. But Whole Foods is going as fast as they can. So you'll see construction starting there on Monday. What I saw, a few weeks ago, or actually a few months ago now, the interior starting to do the build out of the interior. They did the final pouring of the floor on the first floor, and so that's actually working out really well. AMC, so getting a Whole Foods downtown will be good, and I've heard from a lot of residents that really want to see that. AMC has been a little quiet on the theater. AMC overall has questions as far as coming out of COVID-19 and the pandemic restrictions, how people will go to movie theaters and all that. Being said, the city thinks it's a good location as far as that's concerned. It's really in good shape. It's brand new. It's a high level of finish. They have good lease terms. There's no close competition, with Valco closed. It's a fairly good distance between, Mountain View and Santa Clara. So it is a very good location from that standpoint. It's right downtown, walking distance to a lot of things. So it has a lot of pluses. AMC as a business overall, as a company overall, has questions, and whether or not there'll be, questions about bankruptcy, which I've talked about in previous meetings. That being said, these businesses come out of bankruptcy, and that's usually terms. But that's an important, hearing what AMC is going to do as we finally get to the threshold of going to movies, getting to that level. It's really important because they were relatively close, and it's whether or not they start up their movies and how quickly they do that. On a different level, downtown, so the residential construction at Iowa and TAFE still continues, and that's still being allowed under the new order. The phase 2, and that's what the City Line developer really wants to get to. So the downtown specific plan, the EIR is done for the downtown with additional housing and office, and looking at several sites, not just the City Line Center, but several other sites downtown. That's complete, and hopefully that will be moving forward as far as what the City Line development looks like, in the next 3 or 4 months. We'll see how quickly it goes forward, but that's an important thing. Question I got: are golf courses going to open? So from a county order, the county order allowed certain things that included, and I didn't bring up all the different items, but they allowed golf courses, skateboard parks, athletic fields, but as long as people provide, keeping safe social distancing. So a skateboard park can open for teens to go out there. That being said, if you get 50 teens in a small area, the cities will end up closing it down. If it's 1 or 2 teens not interacting, just basically finding a way to exercise, then it can be open. So all that's currently being evaluated from a city standpoint. The county will be allowing golf courses to open on Monday. However, state level, and that hasn't been changed yet, the state says that golf courses are still need to be closed, and all these restrictions are whatever is the most restrictive. So meaning if the county is more restrictive than the state, then we get the county orders. If the state is more restrictive than the county, then the state orders are in place. So golf courses are one of those cases. It's already been mentioned that the Governor Newsom might be opening up the golf courses, and so I think that's that will probably happen in the next day or two, as long as people are providing appropriate safe social distancing. But from a county level, we've already done that. So it's as soon as the state does its changes, then golf courses will open. And I got the question again this week: can we reopen nurseries, garden centers sooner or later? Hate to lose the small nursery centers. We already lost Osh. So good news is all those will be opening on Monday. They will have appropriate measures in place. There will be safe social distancing. But for all those people that are working in their gardens, that are planting vegetables, are planting that victory garden, that's important. So you will have access to that. What can I do to help people in need? So there's a lot of things you can do. I have, friends making masks. We have, the Maker Nexus and lots of maker people in the city creating face shield healthcare industry. One of the things that you can do is donate to Sunnyvale Community Services, and I mention that from now and again. That being, it's really important right now because Sunnyvale Community Services has an anonymous donor that will be matching contributions from Sunnyvale residents up to $250 to a total amount of $100,000. So in matching funds. So for every $150 that each person donates, each Sunnyvale resident donates to Sunnyvale Community Services, that'll be matched dollar for dollar by this anonymous donor. So, double your impact is really critical. So you can make a much bigger impact for those in need. That being said, that started Monday. So that started last Monday, April 27th, and goes to Sunday, May 10th. So if you've been thinking about donating to Sunnyvale Community Services, now's the time. $250 up to $250 per person, which will be matched. And so it's a really good way to, even if it's $5, $10, that's all that money doubled. So thanks to those that have already donated, and go to the Sunnyvale Community Services website, and I've posted about it on my Facebook page. Go to their website and donate online, or anything postmarked before May 10th will also be accepted. I've got this question from a lot of businesses. When is the Small Business Assistance Program going to go live? So 2 weeks ago, 2.5 weeks ago, or about, Sunnyvale Council enacted, or basically approved, the Small Business Assistance Program for the city, and part of that was matching up to $600,000 of donations. So we've had several tech companies give donations to match, to make sure small businesses are supported. So right now we have $400,000 in donations, and I think there's some coming in soon from other tech companies. So Google put in 300, LinkedIn put 100,000, and the city match will be matching that up to 600,000, and all that, the terms, the criteria, all that's been worked through with city staff working with the Enterprise Foundation. We will be doing a press release sometime next week, and at that point, it'll give the timeline of when the URL goes live. I know that the PPP program from a federal level is live today or tomorrow, so it's important that for businesses that are in need, try to get the federal dollars. I know a few of the local businesses that were actually able to get some of those dollars, but that money ran out very quickly. So hopefully, you're looking at the federal programs, not just the Sunnyvale programs. So you'll see the news release sometime next week, but we're hoping to roll that program out, and hopefully it helps maintain some of the businesses that are here. I don't have a library card and like to get one. So, during the shelter in place, the libraries have been closed, the senior center. That being said, there's a wide variety of online material that the library provides. And if you don't have a library card and would like one, you can go to the Sunnyvale website, sunnyvale.ca.gov, and go to Access Sunnyvale. And there's a way of requesting to get a library card. So they will, so put that request in there, and city staff will contact you and walk you through how you can get a library card. Why is it that my gardener who can service a yard by himself with no contact with me is not allowed to work, but real estate agents can continue to show houses? Any chance on the gardener restriction being eased? So the current shelter-in-place order didn't allow gardeners and allowed real estate agents to show houses and allowed a certain amount of real estate agents because people were either selling houses or moving out of the area. That was allowed to continue. Real estate agents were allowed to show houses by appointment only. Now real estate agents are allowed to have open houses starting Monday, and all gardeners will be able to service yards. That being said, whether or not to, mow your neighbor's yard, that's always a possibility, or work in your own yard if you have time. I lost my job. What can I do? Nova, which is our job service center, which helps people either apply for benefits or some with job training. It's fully functional. It is doing remote access and remote contact with people. But go to NovaWorks, NovaWorks.org to find out information. They will give you assistance on signing up for EDD, and that's been EDD is changing a little bit from a state level. They are making it easier for some of the contractors, self-employed, some of the gig economy people to apply. So definitely go to the state pages, but contact NovaWorks about if you've lost your job and are trying to find, either help in applying for benefits or find a new job. That they have a great job training as well as access to a large listing of jobs. One thing I wanted to highlight was that the Heritage Park Museum, so the Historical Society, is trying to document what people are doing during COVID-19. And, at some point we finally come out of this, and it's documenting it for future generations. So we're living through an unprecedented time, to say the least. And so if you to document your thoughts, your photos, take a look at the website for the museum, Sunnyvale Heritage Park, heritagemuseum.org, heritageparkmuseum.org, and take a look at that site. Let me get it right, heritageparkmuseum.org, or take a look at their Facebook page, and there's a way of posting your photos, your thoughts, your comments on a daily basis, on a weekly basis. I know this is affecting a lot of people, but I've, on my morning runs, I've seen a lot of good messages and and those chalk on sidewalks, on driveways. It's really been impressive of how people have responded. Signs on mailboxes. It's really good to see how people are responding, and it's really a great time from that standpoint to see community trying to reach out and brighten other people's lives, even when they have to socially distance. Let's see some of the questions that I got today. Any word on when construction permits and inspections can resume? My family is renting while our construction has been halted for the last 2 months. So with the county measure starting on Monday, that will also open up a certain amount of city staff, and they'll have to have the appropriate measures in place. But with construction, with resident commercial construction being restarted, the appropriate inspections need to take place, and staff is figuring out how to do those permits, how to deal with inspections. Currently they're already handling a small portion that's handling it for that residential with affordable housing. So that will be ramped up. That the continual evaluation of resources to make sure that we're able to respond to whatever those are. Yeah, I saw the already answered the question about Whole Foods. Whole Foods is looking like late August, September. Keeping my fingers crossed, might be sooner. We'll see how quickly they can finish out the interior of their store and then getting stocked up. The sooner that we have another market in our community that's available, the better it is for everyone. So are you mandating face masks in Santa Clara County? I'm pushing them to make that clearer for all of our residents. It was kind of embedded in the order, as opposed to 2 weeks ago when 5 of and then ultimately 6 of the counties in the Bay Area declared that they mandated face masks for residents whenever they couldn't either socially distance when out, or they were inside of a public building, a building that was not their home. It took a while, and the order has changed. It's fairly clear as I read it that the business procedures need to be put in place. That being said, it's not been widely publicized, and so making sure that that's public is really important. March 4th, following new restrictions, residential construction is supposed to be able to resume in the Bay Area. Sunnyvale has not announced virtual inspections or permit resumption. Can you answer when Sunnyvale will begin taking virtual inspections? That inspections themselves, I don't think can be virtual. We do have enough PPE, so enough protective equipment for our employees, and we're constantly inventorying that. We have given that to some of our employees who are now doing helping staff Sunnyvale Community Services, helping collect groceries, collect medication, and deliver that. And wearing PPE during those deliveries has been important. So I don't know if there will actually be virtual inspections, but I think there will be actual inspections, making sure that anyone that's out there, any of our inspectors are adequately prepared. It bothers me they put the age for mask at age 2. The limit should be kids under 5 are exempt. You can't reason with a 4-year-old. Yeah, I was looking at that. I can't remember it's changed in the latest order. If I remember, I thought it was children under 7 that didn't have to wear masks. I'll double check that and publish it on my page. Are you going to allow public? Are you going to allow general public if you open up soon? No idea. Oh, that's right. Gilead isn't a Sunnyvale company. Do we produce enough construction material here, depending on import? So Construction materials are kind of, some are the US, some are from the US, some are from other countries, of course, and that depends on, where things are sourced. We're constantly getting new materials. There are shipments coming in, so you're seeing, masks coming in from China and other countries. So there is kind of a world economy still going on, but it is very dependent upon what we have. And then, do we need face masks for hospitals or first responders? Yes, those face masks are, that supply, especially for healthcare workers, is really important. Go to the Valley Medical Foundation. They're taking donations. We're still taking them from a city standpoint because we want to make sure we have adequate supplies. Right now, we have a good inventory. That being said, we still take them because it's worth, in our best interest. And I think that's it for now. And I was wrong. So the Gilead was Foster City. You're absolutely right. There was a mention that, so Gilead was for Foster City. The Cepheid Sunnyvale company actually had another press release earlier this week that the FDA has done some approval for their testing. So sorry, I mixed up those two things. The ad thing is important for reducing the recovery. The Cepheid Sunnyvale company is improving testing. So they're rolling out their test kits. So that's pretty much it as far as questions are concerned. Let's go ahead and wrap. We're already after 10 o'clock. I thought I was early today. Thanks again for joining this week. Please email me if you have questions, comments, concerns. Add them to the comments for this blog or other comments, other portions of my Facebook blog if you have them. This is a very interesting time, at least, but I'm proud of our community response. Whether or not it's helping each other, picking up grocery, hearing more about different groups in our community, picking up grocery medication for neighbors, mowing lawns, sharing homemade goods. It's fantastic, and it's good to see how this has brought the community together. I'm really proud of Sunnyvale's response. It's really good that our community has bonded together, socially apart, but working together to try to do what we can for everyone. So if you're out to walk, be safe, say hello to people. It's difficult to share, miss the social bonding that you have with people. And, as far as I'm concerned, people miss that daily interaction, and whatever you can do to make somebody else's day is really critical. This is a difficult time for a lot of people, but we will get through this. We're in this together. We'll get through this together. So thanks for listening, as always. Have a great week, and I'll see you next Friday. Take care. See you. Bye.